NHA Medical Assistant Final Review. Question 1. When only the medial antecubital vein is prominent, why should the assistant use extra caution before selecting the basilic vein? Option A. Recognizes its proximity to nerves and the brachial artery. Option B. Prioritizes safety and permits prompt positioning and assessment. Option C. Preserves analyte stability and supports accurate results. Option D. Stops blood leakage into tissue and limits enlargement of the hematoma. The correct answer is option A. Recognizes its proximity to nerves and the brachial artery. Use extra caution before selecting the basilic vein. It recognizes its proximity to nerves and the brachial artery. Stopping the draw prioritizes safety and permits prompt positioning and assessment, while transporting specimens under required conditions preserves analyte stability and supports accurate results. Removing the needle stops blood leakage into tissue and limits enlargement of the hematoma. Question 2. A CLIA and laboratory quality review uses the term test system record. Which description is accurate? Option A. A record showing storage or testing conditions over time. Option B. Documentation of controls, calibration, maintenance, and corrective actions. Option C. An error occurring before the specimen is tested. Option D. Federal requirements intended to make laboratory results accurate, reliable, and timely. The correct answer is option B. Documentation of controls, calibration, maintenance, and corrective actions. Test system record means documentation of controls, calibration, maintenance, and corrective actions. It provides evidence that quality requirements were followed. Temperature log means a record showing storage or testing conditions over time. Pre-analytical error means an error occurring before the specimen is tested. CLIA quality standards are federal requirements intended to make laboratory results accurate, reliable, and timely. Question 3. Which outcome supports offering water with an oral tablet when permitted when a patient is receiving a routine swallowed medication? Option A. Straightens the adult ear canal for administration. Option B. Supports safe swallowing unless fluid is restricted. Option C. Prevents medication from being given to the wrong patient. Option D. Prevents unintentional dose stacking. The correct answer is option B. Supports safe swallowing unless fluid is restricted. Offering water with an oral tablet when permitted supports safe swallowing unless fluid is restricted. Pulling the adult pinna upward and backward for ear drops straightens the adult ear canal for administration. Using two identifiers before giving medication prevents medication from being given to the wrong patient, and removing an old transdermal patch before applying a new one prevents unintentional dose stacking. Stressed about your NHA Medical Assistant Exam? We can take NHA Medical Assistant Exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Which description from Insurance Fundamentals corresponds to N-network provider? Option A. Confirmation that coverage is active for the date of service. Option B. A plan allowing broader provider choice with incentives for network use. Option C. A clinician or facility contracted with the health plan. Option D. Advance payer review of a planned admission or service. The correct answer is option C. A clinician or facility contracted with the health plan. N-network provider refers to a clinician or facility contracted with the health plan and usually provides services under negotiated rates and lower patient cost. Eligibility verification refers to confirmation that coverage is active for the date of service. Preferred provider organization refers to a plan allowing broader provider choice with incentives for network use, and pre-certification refers to advance payer review of a planned admission or service. Question 5. How does spacing multiple injections according to guidance help when more than one vaccine is given in the same limb? Option A. Provides a site with fewer major nerves and blood vessels. Option B. Enables prompt first aid, risk evaluation, documentation, and post-exposure care. Option C. Permits identification of local reactions and avoids overlapping sites. Option D. Improves antisepsis and reduces stinging from wet alcohol. The correct answer is option C. Permits identification of local reactions and avoids overlapping sites. Space multiple injections according to guidance. It permits identification of local reactions and avoids overlapping sites. Using the ventrogluteal site when an appropriate larger muscle is needed provides a site with fewer major nerves and blood vessels, while reporting a needle stick immediately enables prompt first aid, risk evaluation, documentation, and post-exposure care. Cleaning the site improves antisepsis and reduces stinging from wet alcohol. Question 6. During HIPAA privacy and security review, the assistant encounters mandatory reporting disclosure. What does this term mean? Option A. The document explaining how an organization may use information and the patient's privacy rights. Option B. The information released when a law requires reporting such as certain abuse cases. Option C. Posting identifiable patient information on a public platform. Option D. A record of certain disclosures available to the patient on request. The correct answer is option B. Information released when a law requires reporting such as certain abuse cases. Mandatory reporting disclosure means information released when a law requires reporting such as certain abuse cases. It is limited to the authority and information required. Notice of privacy practices means the document explaining how an organization may use information and the patient's privacy rights. Social media disclosure means posting identifiable patient information on a public platform. Accounting of disclosures means a record of certain disclosures available to the patient on request. Question 7. The assistant plans to clean from the least contaminated area toward the most contaminated area after noting that a linear surgical wound is being cleansed. Which reason supports this step? Option A. Avoids dragging organisms into cleaner tissue. Option B. Limits tissue trauma and pain during removal. Option C. Avoids tissue-damaging products unless specifically prescribed. Option D. Protects exposed tissue and requires prompt assessment. The correct answer is option A. Avoids dragging organisms into cleaner tissue. Cleaning from the least contaminated area toward the most contaminated area avoids dragging organisms into cleaner tissue. Removing the old dressing gently limits tissue trauma and pain during removal. Using the ordered solution such as sterile normal saline avoids tissue-damaging products unless specifically prescribed, and covering a dehisced incision with a sterile dressing protects exposed tissue and requires prompt assessment. Question 8. After recognizing that a small approved office purchase is made, why should the assistant follow policy for petty cash? Option A. Captures plan identifiers and claims information accurately. Option B. Ensures older usable supplies are consumed before newer stock. Option C. Prevents reconstruction or unauthorized access. Option D. Preserves accountability through receipts and reconciliation. The correct answer is option D. Preserves accountability through receipts and reconciliation. Following policy for petty cash preserves accountability through receipts and reconciliation. Scanning both sides of the current insurance card captures plan identifiers and claims information accurately. Rotating stock by expiration date ensures older usable supplies are consumed before newer stock, and using secure destruction for records containing protected information prevents reconstruction or unauthorized access. Are you looking for NHA Medical Assistant Exam actual questions? Visit our website pokerexams.com to access NHA Medical Assistant Exam Study Guide with actual questions and answers. Scan the QR code or click the link in the description to get NHA Medical Assistant Exam answer key today. Question 9. In this situation, the assistant is preparing to dispose of the device. Why is not recapping a used injection needle appropriate? Option A. Provides a site with fewer major nerves and blood vessels. Option B. Creates a complete medication record for continuity and safety. Option C. Improves delivery to the intended tissue layer. Option D. Prevents a common cause of needle stick injury. The correct answer is option D. Prevents a common cause of needle stick injury. Avoid recapping a used injection needle. This prevents a common cause of needle stick injury. Using the ventrogluteal site when an appropriate larger muscle is needed provides a site with fewer major nerves and blood vessels. Documenting the drug, dose, route, site, time, and response creates a complete medication record for continuity and safety, and selecting needle length based on route, site, and tissue depth improves delivery to the intended tissue layer. Question 10. Which result is expected from reviewing copied or templated text before signing when a prior note is used as a starting point? Option A. Prevents unauthorized viewing or entry. Option B. Shows who viewed or changed information and when. Option C. Prevents credentials from being issued to the wrong person. Option D. Prevents outdated or inaccurate information from carrying forward. The correct answer is option D. Prevents outdated or inaccurate information from carrying forward. Reviewing copied or templated text before signing prevents outdated or inaccurate information from carrying forward. Locking prevents unauthorized viewing or entry. Recognizing the audit trail as a record of system activity shows who viewed or changed information and when. And verifying portal identity before activation prevents credentials from being issued to the wrong person. Question 11. When a plasma chemistry specimen is required, why should the assistant recognize heparin as the green tube additive? Option A. Reduces anticoagulant carryover into serum testing. Option B. Maintains the proper ratio needed for reliable coagulation results. Option C. Inhibits clotting while allowing plasma separation. Option D. Follows the standard sequence among anticoagulated tubes. The correct answer is option C. Inhibits clotting while allowing plasma separation. Recognize heparin as the green tube additive. It inhibits clotting while allowing plasma separation. Collecting serum tubes before heparin and EDTA tubes reduces anticoagulant carryover into serum testing. Filling a light minus blue tube to its stated line maintains the proper ratio needed for reliable coagulation results. And collecting lavender or pink EDTA tubes before the gray tube follows the standard sequence among anticoagulated tubes. Question 12. Why is sending protected messages through approved secure channels appropriate when a patient asks for clinical information by email? Option A. Follows role-based access and privacy requirements. Option B. Makes safety data visible to ordering and decision-support systems. Option C. Protects content in transit and follows organizational policy. Option D. Improves accuracy and supports timely clinical use. The correct answer is option C. Protects content in transit and follows organizational policy. Send protected messages through approved secure channels. This protects content in transit and follows organizational policy. Accessing only records needed for assigned duties follows role-based access and privacy requirements. Reconciling medications and allergies in structured fields makes safety data visible to ordering and decision-support systems, and recording information promptly and objectively improves accuracy and supports timely clinical use. Question 13. In medical terminology exam preparation, bradycardia appears as a key term. Which meaning is correct? Option A. A heart rate below the expected range. Option B. Toward the back of the body. Option C. A temporary absence of breathing. Option D. Arterial blood pressure below the expected range. The correct answer is option A. A heart rate below the expected range. Bradycardia refers to a heart rate below the expected range and describes an abnormally slow heart rate for the patient's age and condition. Posterior refers to toward the back of the body, apnea refers to a temporary absence of breathing, and hypotension refers to arterial blood pressure below the expected range. Question 14. What is the main reason to obtain and document a patient history when the provider needs current symptoms and background information? Option A. Performs an authorized data-gathering task without diagnosing. Option B. Verifies the act of signing while keeping disclosure duties with the provider. Option C. Performs venipuncture within competence and applicable law. Option D. Seeks clarification and prevents harm without silently proceeding. The correct answer is option A. Performs an authorized data-gathering task without diagnosing. Obtaining and documenting a patient history performs an authorized data-gathering task without diagnosing. Witnessing a consent signature without providing the provider's explanation verifies the act of signing while keeping disclosure duties with the provider, while collecting blood specimens when trained and authorized performs venipuncture within competence and applicable law. Using the chain of command for an unsafe instruction seeks clarification and prevents harm without silently proceeding. Question 15. How does maintaining reagent and equipment temperature logs help when a refrigerator stores controls and test kits? Option A. Documents that required storage conditions were maintained. Option B. Avoids scratching optical surfaces with ordinary tissue. Option C. Helps locate the specimen and reduces risk of lens-slide contact. Option D. Identifies unilateral deficits that binocular testing may conceal. The correct answer is option A. Documents that required storage conditions were maintained. Maintaining reagent and equipment temperature logs. Documents that required storage conditions were maintained. Using lens paper to clean microscope optics avoids scratching optical surfaces with ordinary tissue. Beginning microscope focusing with low power helps locate the specimen and reduces risk of lens-slide contact. And testing each eye separately during visual acuity screening identifies unilateral deficits that binocular testing may conceal. Question 16. Which option accurately defines melena in the area of medical terminology? Option A. Painful or difficult urination. Option B. Black tarry stool caused by digested blood. Option C. Toward the back of the body. Option D. Having a rapid onset and usually a short course. The correct answer is option B. Black tarry stool caused by digested blood. Melena describes black tarry stool caused by digested blood. It commonly suggests bleeding higher in the gastrointestinal tract. Dysuria describes painful or difficult urination. Posterior describes toward the back of the body. Acute describes having a rapid onset and usually a short course. Question 17. The assistant plans to place V4 before V3 after noting that the assistant is applying precordial electrodes in sequence. Which reason supports this step? Option A. Provides the landmark needed to position V3 midway between V2 and V4. Option B. Completes the lateral chest-lead sequence on the same horizontal level. Option C. Alerts the interpreter that the tracing was obtained with an adaptation. Option D. Provides a reliable landmark for counting ribs and spaces. The correct answer is option A. Provides the landmark needed to position V3 midway between V2 and V4. Place V4 before V3. It provides the landmark needed to position V3 midway between V2 and V4. Placing V6 level with V4 on the left mid-axillary line completes the lateral chest-lead sequence on the same horizontal level, while documenting non-standard placement alerts the interpreter that the tracing was obtained with an adaptation. Locating the fourth intercostal space from the sternal angle provides a reliable landmark for counting ribs and spaces. Question 18. The provider documents National Correct Coding Initiative edit during a billing and coding basics review. Which description should the assistant recognize? Option A. Selection of the most detailed supported diagnosis code. Option B. A change to payment or patient balance after processing. Option C. A coding rule designed to prevent improper code combinations. Option D. The code category used for many office visits. The correct answer is option C. A coding rule designed to prevent improper code combinations. National Correct Coding Initiative edit is a coding rule designed to prevent improper code combinations. It identifies services that should not normally be billed together. Code specificity is selection of the most detailed supported diagnosis code, while claim adjustment is a change to payment or patient balance after processing, and evaluation and management code is the code category used for many office visits. Stressed about your NHA Medical Assistant Exam? We can take NHA Medical Assistant Exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. How should opioid be understood when studying basic pharmacology? Option A. A medication used to reduce fever. Option B. A medication that reduces nasal mucosal swelling. Option C. A controlled analgesic class that can cause respiratory depression. Option D. A non-insulin medication used to improve glucose control. The correct answer is option C. A controlled analgesic class that can cause respiratory depression. Opioid refers to a controlled analgesic class that can cause respiratory depression and provides strong pain relief but requires monitoring for sedation and misuse. Antipyretic refers to a medication used to reduce fever. Decongestant refers to a medication that reduces nasal mucosal swelling. And oral hypoglycemic refers to a non-insulin medication used to improve glucose control. Question 20. Which result is expected from confirming the preferred resolution when possible when a patient wants help with a service problem? Option A, gives an update and offers voicemail or a callback. Option B, aligns the response with the patient's actual need. Option C, supports rescheduling or other approved solutions without false promises. Option D, gets the issue to someone able to decide. The correct answer is option B. Aligns the response with the patient's actual need. Confirm the preferred resolution when possible. This aligns the response with the patient's actual need. Returning to a caller placed on hold within a reasonable time gives an update and offers voicemail or a callback, while offering realistic options during a delay supports rescheduling or other approved solutions without false promises. Escalating unresolved complaints through the chain of command gets the issue to someone able to decide. Question 21. During medical law and ethics review, the assistant encounters standard of care. What does this term mean? Option A, the level of conduct expected under similar circumstances. Option B, a false defamatory statement spoken to another person. Option C, the ethical duty to avoid causing harm. Option D, a document stating preferences for future health care. The correct answer is option A, the level of conduct expected under similar circumstances. Standard of care means the level of conduct expected under similar circumstances. It helps determine whether professional duties were met. Slander means a false defamatory statement spoken to another person. Non-maleficence means the ethical duty to avoid causing harm. Advance directive means a document stating preferences for future health care. Question 22. Why is issuing a receipt for patient payments appropriate when a co-payment is collected at checkout? Option A, preserves accountability through receipts and reconciliation. Option B, documents the transaction for both patient and practice. Option C, uses data to identify causes and improve processes. Option D, reduces incidental disclosure of protected information. The correct answer is option B. Documents the transaction for both patient and practice. Issue a receipt for patient payments. This documents the transaction for both patient and practice. Following policy for petty cash preserves accountability through receipts and reconciliation. Participating in quality minus improvement tracking uses data to identify causes and improve processes. And protecting documents from view at the reception desk reduces incidental disclosure of protected information. Question 23. Which outcome supports placing V3 midway between V2 and V4 when V2 and V4 have already been positioned? Option A, records the left minus arm electrical reference without reversing sides. Option B, verifies that wires are attached to the intended electrodes. Option C, protects privacy without sacrificing placement accuracy. Option D, uses the two established landmarks to locate V3 accurately. The correct answer is option D, uses the two established landmarks to locate V3 accurately. Place V3 midway between V2 and V4. This uses the two established landmarks to locate V3 accurately. Placing the left minus arm electrode on the left upper limb area records the left minus arm electrical reference without reversing sides. Tracing each lead wire back to its labeled connector verifies that wires are attached to the intended electrodes. And using respectful draping while locating landmarks protects privacy without sacrificing placement accuracy. Question 24. Within insurance fundamentals, which description best explains allowed amount? Option A, a formal request for reconsideration of a payer decision. Option B, a clinician or facility contracted with the health plan. Option C, an organization that pays health claims on behalf of an enrollee. Option D, the maximum contracted amount a plan recognizes for a service. The correct answer is option D, the maximum contracted amount a plan recognizes for a service. Allowed amount refers to the maximum contracted amount a plan recognizes for a service and forms the basis for payer and patient cost sharing. Appeal refers to a formal request for reconsideration of a payer decision. Network provider refers to a clinician or facility contracted with the health plan, and third-party payer refers to an organization that pays health claims on behalf of an enrollee. Question 25. In Billing and Coding Basics Exam Preparation, ICD-10-CM appears as a key term. Which meaning is correct? Option A. The payer report explaining payment and adjustment decisions. Option B. The code element added to a procedure code to communicate a special circumstance. Option C. The claim code identifying where care was delivered. Option D. The code set used to report diagnoses and health conditions in outpatient care. The correct answer is option D. The code set used to report diagnoses and health conditions in outpatient care. ICD-10-CM refers to the code set used to report diagnoses and health conditions in outpatient care and communicates the reason for services and supports medical necessity. Remittance advice refers to the payer report explaining payment and adjustment decisions. Modifier refers to the code element added to a procedure code to communicate a special circumstance. And place of service code refers to the claim code identifying where care was delivered.